So we get to look at what an operative note in gynecology is. Okay, mainly we are trying to look at the components. What will you find in an operative note? So operative note is more of like, maybe they want to do an operation for you. Okay, so there's a note they'll give you, or maybe after the operation there's a note they will give you. So what are the informations you might likely find in this? So for the operative note, you see an example, but probably in the lecture you look at more details how a standard one should look like. So it's just a detailed medical document. It's written immediately after a surgical procedure. Okay, so it's after the surgical procedure. Write names of all the doctors that were there and all, okay, what they did, what they found. Do you understand? The care, they just everything is there. Okay, so let's discuss. So it serves as a legal record, clinical summary, outlining what is done, why it is done, how the patient responded. So these documents are essential for continuity of care. Even if you are moving from this facility to another facility, the other facility will know what they did in the previous facility. All right, if they want to charge you for the surgery, they can now calculate everything. Okay, everything that was used during the surgery, the anesthesias, the everything and all, the medical legal documentation. So sometimes, I always say that the gynecological aspect of medicine is that part of medicine that has the highest number of law cases. So you always need this, okay, because if any of those women sue you up, you can still present that, okay, this is what we did. Okay, so what are the things you find in a gynecological operative note? So it's quite a lot of information. So what I want you to do is, I'll be focusing on the section where you can pause to look at the description. That's what's to be found in that section. So for patient information, of course, name, age, all those ID number. It could be the hospital ID number or the national identity card. Preoperative diagnosis. What did you guys actually find that made you guys to now opt in for that procedure? Postoperative diagnosis. So after the surgery, were you able to find extra things, or were you able to find something that was totally different from what you guys thought before the surgery? You indicate. Okay, procedure performed, name of the surgery, surgeons and assistants, everybody that was there, the anesthesiologist, everybody, somebody that was giving in all those instruments and all. Anesthesia type, okay, was it general, spinal, epidural, local? Operative findings, what do you guys actually observe in the surgery? Okay, details of procedure, how was it done? Specimen sent, did you people actually find any abnormal tissue that needed attentions from the laboratory, and did you guys actually send it? Estimated blood loss, okay, complications, post-operative condition. Of course, blood loss, you still indicate if this patient was transfused after the surgery. Okay, so examples of common procedures that can be documented in gynecology: total abdominal hysterectomy, they remove your uterus. Okay, laparoscopic salpingectomy, okay, they remove your fallopian tube. Dilation and curettage. Myomectomy, this one is basically to remove all those fibroids, uterine fibroids, okay, from the myometrium. Endometrial ablation, tubal ligation, okay, pelvic floor repair, okay. All this, I'm not saying only this one, so I'm just giving you guys examples, okay. Of course, to me, almost everything that you're doing on a woman's body, always document it, okay. There's a whole lot of complications there. All right, so that's what an operative note in gynecology will contain.